Welcome to the PASRR Pre-Admission Screening and Resident Review Level 1 Submission Training. I know some folks are just joining us now. I'm seeing the number of people joining continue to go up. So while people are joining, I'm going to just give you a few housekeeping bits of information. We are going to be recording this training today. We would appreciate it if you would stay on mute through the presentation of the training materials today. We know you're going to have some questions. When you do, please hold on to them until after our training presentation is complete, and you can put them in the chat if you like at that time. We'll also make sure that you can come off of mute and ask your questions directly to us verbally. We will go through material here that is both slides that will be available to you. We'll be posting those to the chat as well. Those are also available on the department's website, and we will put that link into the chat here momentarily for you. We also have a desk aid for you, which we'll post to the chat, and you can download it from the chat. It's also available on the department's website, and that desk aid takes you step by step through how to submit a level 1 into Telligen's system called Qualitrac. All right, it is 1 minute after. Again, just a reminder, please stay on mute until we're done presenting the training material. I'm going to now introduce Beth Elby, who is our lead level 1 reviewer, and Beth will begin our presentation today. Beth?
Thanks, Pam. I'm just going to come off of or come onto video just to say hi. Thanks everybody for joining us. We appreciate you being here. We're happy to welcome you back to PASRR. All right. So, oh, I feel like I can hear folks talking. If you can please make sure that you're muted, that would be very helpful. Today's training, we're going to offer an overview of registering for Qualitrac. We're going to go over a demonstration of entering an actual case into Qualitrac. And at the end, as Pam mentioned, we're going to take questions. Today's focus is submitting the level 1. So if there are additional topics or questions that you may have, you can put them in the chat or email Margaret, Shelley, or Telligen directly to get those addressed. Next slide, please. All right, so the who's who of who all is on the call today. From the state, we have Margaret Anderson, who is the PASRR administrator, as well as the State Intellectual Disability Authority. We have Michelle or Shelley Voss with BHA. She's our State Mental Health Authority. From Telligen, we have Pam, who you just met, our contract manager. We have Callie Baker. She's our lead level 2 MI assessor. We have Trisha Bond, who is our lead IDD level 2 assessor and administrator. We have myself and Cassie Winters, who is a level 1 reviewer and also QA's level 2s for us. As we mentioned, you know, this is new to you guys. You're just coming back on to submitting PASRR, so we're going to provide it here. We're also going to put it in the chat, but you have access to our help desk, the Colorado Support Center with Telligen. So here's their telephone number or email address. These folks are going to be able to help you with anything that you may have questions about submitting cases or outcomes on cases, things like that. So you're going to want to make sure you keep this number handy. I'm going to pass to Margaret now for an overview of PASRR.
Great, thanks, Beth. I'll come on video as well for a moment and just say hi to everyone and thank you all for joining us today. I'm Margaret, the new PASRR administrator, for those of you that haven't seen me on our Tuesday TA calls. So I'm just going to stop my video and then I'll start. So today I'm going to just provide a brief overview of PASRR, which may be a refresher for some and new information for others. So first, what does PASRR stand for? It stands for Pre-Admission Screening and Resident Review. As part of the Omnibus Budget Reconciliation Act, or OBRA, enacted in 1987, Congress developed the PASRR program to prevent inappropriate admission and retention of people with mental disabilities in nursing facilities. So federal law mandates that Medicaid certified nursing facilities may not admit an applicant with serious mental illness, intellectual disability, or related condition unless the individual is properly screened, thoroughly evaluated, and found to be appropriate for nursing facility placement. Next slide, please. Additionally, if an individual is found to have a PASRR condition, they will receive specialized services necessary to meet their unique needs. So PASRR is a powerful and effective program which was established to ensure the person with serious mental illness, intellectual and/or developmental disabilities are placed in the least restrictive setting and receive recommended interventions to improve their quality of life. Next slide, please. So this slide is it shows you each group and their responsibility when it comes to PASRR. So first we have the CMA or case management agencies. They're responsible for submitting level 1 screens for Medicaid clients who are being admitted to a nursing facility from the hospital or from the community. And then we have nursing facilities. They're responsible for submitting level 1 screens for individuals coming in from the community who are non-Medicaid. And lastly, we have hospitals. They're responsible for submitting level 1 screens for non-Medicaid clients who are admitting to the nursing facility from the hospital. Next slide, please. So this slide is a walkthrough of the steps to complete the PASRR process. So in box 1, we have the level 1 being submitted. In box 2, we have the level 1 will be completed within 6 business hours. Outcome letters will be attached to completed cases, and if more information is needed, an RFI or request for information will be issued. Box 3, if a level 2 evaluation is needed, Telligen will contact the submitter to gather more information and facilitate the level 2 evaluation. Box 4, the Telligen evaluator will contact the submitter, usually the case manager at the hospital or the CMA, and gather collateral information, and then they will go to the hospital or home to complete the psychosocial evaluation. Box 5, the completed evaluation will be reviewed by the Telligen quality team and clinical reviewer, and then the state will review the evaluation, and once that is complete, the state will attach the NOD or notice of determination. Box 6, the final box, the submitter or you guys can retrieve the level 2 evaluation and NOD from Qualitrac. So Qualitrac should be sending a notification when the case is complete. And also please remember that a completed PASRR packet is needed prior to admission to the nursing facility. Next slide, please. So here's another way to look at PASRR. It kind of helps to break it down into its 2 components. First, you have the PAS or pre-admission screening, and then you have the RR or resident review. Today, we're focusing on the PAS of PASRR because that's the process you'll be completing. So with the PAS, you can see the 3 outcomes after you submit the level 1 screen. The first one is you may have a provisional admission, which we will discuss later in the training. You may have a level 1 outcome with no level 2 needed, and that's all that's required. Or you may have the last one, which is a level 2 needed, and that's when we begin the level 2 evaluation process. So now I'm going to pass it to Pam, who's going to cover the Qualitrac access. Thank you, guys.
Thanks, Margaret. I'm going to go ahead and turn on my camera for just a second and say hello again. I realized I didn't do that when I introduced our session today. So hi, everyone. Glad you could be with us. I'm going to talk about the Qualitrac process. In this first slide, you'll see that we have different roles for the 3 different people at your organization. The first role is the provider executive. This person is the person who is responsible for committing the organization to agreements such as the terms and conditions of using Qualitrac, our provider portal, and that agreement that comes along with it. That person also is the person who would designate 1 or more people as authorized officials within your organization. The authorized official is the person who would be responsible for adding and removing user accounts for other people within your organization. The authorized official is usually not the executive, though it can be the executive. We do recommend that you have at least 2 authorized officials so that if one is not available, the other one would be able to help your users with establishing accounts, removing accounts when that person leaves your organization, or helping with issues like passwords. And then there are the provider portal users, which is going to be most of you, those of you who will be submitting requests to Telligen. That's the person who we will interact with the most, although we will also interact with all of you at various times. Next slide, please. I want to just explain that the Qualitrac provider portal model is a security model that is set up as a delegated security model. Again, that provider executive is the person who delegates authority to the authorized official to manage, set up, and remove those user accounts for you. There should be at least one authorized official. In each organization, we recommend that you have at least two, and you cannot have more than a certain number. And everybody in your organization should not be an authorized official so that you keep your security tight for the parts of this model that you're responsible for. We also want to make note that for HIPAA compliance, any staff members who have accounts should each have their own account with their own password. They must have their own login name and password to be able to use Qualitrac. If we find that there are generic logins and multiple people are logging in using a generic login, we will have to disable that account. So when you are setting up your structure, make sure that your authorized official is providing an account for each individual person that is going to access Qualitrac. And next slide, please. To begin your registration for Qualitrac, please visit the department's website. There's a link here on this slide for that. I also pasted it into the chat, and Shelley has pasted it in again. You can just use that link, go to the department's PASRR webpage, and at the top of that page, you're going to see three big blue buttons. The one on the right, the furthest one to the right, the provider portal, is where your executive will begin the registration process. It's a pretty quick process. It's done through an electronic form in DocuSign, and the executive can register one time for each authorized official they're going to delegate. So within the registration process, the executive will delegate to one authorized official at a time. If you have two authorized officials, your executive would complete this process twice. And please note that it takes 5 to 7 business days or so to set up an account. I believe most of the hospitals and case management agencies who are with us today have already registered for Qualitrac, although if there have been changes to your ownership, or if you find that you haven't already signed up for use of Qualitrac, please go ahead and do this as soon as possible so we can get your account set up and activated. And then once that happens, your authorized officials will receive a notification that they can go ahead and set up the users for all the other folks at your organization. And next slide, please. The next thing you're going to want to know to do is to access Qualitrac to begin submitting reviews. So you can do this two ways. Probably the easiest way is to go to the department's web page again with that link that we gave you before, and click on that middle button that says Qualitrac Login. When you click that button, a pop-up is going to come up that allows you to sign in. You would enter the username that you received in a confirmation email and the password that you're going to use for that. That username would be set up by your AO, again, your authorized official. And if you have any trouble logging in, at the bottom of that pop-up screen is a reset password link that you can use to reset your password and walk through an automated process to do that. If you have any trouble with this, you can contact our support center. And I did put that information into the chat again, and I'm going to paste it in again now. Call the support center during regular business hours, and a live agent can help you get through that process of getting your account activated. Once your account is created, you will receive a notice from Qualitrac that your account is there and you need to get logged in within 1 week or the account will be deactivated. If that deactivation happens, you're going to want to call the support center so they can send you a new message with a link to activate your account. Okay, and next slide, please. All right, we are going to do a demonstration of entering a level 1 screening in Qualitrac now, how to submit that request and how to complete the screening part of it. Cassie Winters is one of our level 1 reviewers and also a level 2 QA reviewer. She and I are going to walk you through that process right now. Give me just 1 second and I'm going to share our demonstration with you.
Thanks, Pam. Hi, everybody. My name is Cassie, and I'll be helping to co-narrate this portion of our presentation today. Just a couple housekeeping things as Pam is getting this pulled up for us. First things first, adjust your screen image or go to a full screen view in order to see the details of this demonstration. This is simply here just to help give you guys a visual of what you'll be expecting as you get into the system. And it was also brought to my attention that this video tutorial will also be available on the state website after today. So you guys can also grab that from there.
Okay,
so
here we go.
So to get started, once you log into Qualitrac, you're going to come into the dashboard. So you will see case care management and utilization management. And today we're going to show you how to search for an individual. And you can do that 2 different ways. You can start the tasks or you can use the search. We will also show you, as Pam mentioned, how to enter that assessment and how to find those notices of decisions to go and print.
And I'll just add, Cassie, that for the purposes of PASRR, you're always going to use the utilization management options.
Right. So in this, you can choose the different ways to search for a member. We're going to use the member search. And here is where you're going to enter a member ID and a date of birth, or a first name, a last name, and a date of birth. And for the purpose of this training, we're going to choose first name, last name, and date of birth. Just be mindful as you enter this information that it is correct for that person. Sometimes you'll see where individuals may have alternate names or nicknames. Just make sure you know how to enter that person so that you can find them in the system if they're there. If you find that your person has not been entered, you can choose the orange button, Add Member. This will pull up this demographic screen, which will have first name, last name, and other identifying details. If you'll notice, it appears small, but there are red asterisks or stars that are behind the required information that you will need to fill in and have.
Notice that when you're filling in the social security number or member ID that are both required, if you don't have those, you can click the NA box, which will allow you to move forward, and the system will create a temporary ID for that member, which will remain their ID in the system.
So once that's completed, you can click Submit.
And just a reminder of the required fields where the red asterisk is attached.
Once that happens, it will take you to the Member Hub. And this is where you're going to utilize the Utilization Management panel to add that PASRR Level 1. So by clicking the Add button, it will begin that process. So in the authorization request, the date requested will be automatically filled in. You're going to choose your review type, PASRR Level 1. It will automatically fill in nursing facility and long-term care. You don't have to touch those. They can stay as they are. And then you can choose your timing. Timing will have prospective or concurrent. Concurrent is those instances that may be used more by the SNF where they're doing resident reviews, and perspectives will be more focused for hospitals, CMAs, and those, as they are projecting dates of when this person may be going into that nursing facility. Once that's completed, you add new requests. The next panel you'll enter in is the admission date and admission and discharge. So because we chose perspective, we're going to choose a future date for that admission. You're going to choose your admission type and your admission source. The next panel is coverage. And this is a panel that's available for other contracts that Telligen also maintains. And for the purpose of this training and for this particular piece, you guys can just enter NA in the eligibility comments, as we do not review for insurance, but there is something required, as you can see that there is a small red asterisk right behind that. The next panel is providers. So this is where you can add your treating physician, treating facility, and ordering provider. This is where it's important, if possible or known, to enter NPI number, as it is a unique ID that can expedite the process in finding that person or that entity. If you don't know that, then you can choose to add additional details as I am demonstrating and put as much in as you can to help narrow down the field. After that, you can choose search. And by clicking the green add button, that will add that particular provider to the panel. Next, you can choose the treating facility. And this is where I knew an NPI number, and this is where you can plug that number in.
We highly recommend, and you'll hear us saying this more than once, the treating facility is going to be the nursing facility that the person is going to be admitting to, or the one you think they're going to be admitting to. And it's really important to use the NPI number or listing of that facility that facility is using when they're in Qualitrac. That way they can see this case just by you adding them here.
The ordering provider, you can see there is drop downs where you can choose and copy in a treating facility or physician. In this case, I chose to just copy that over, but the ordering provider would be the hospital or the CMA making the request.
And again, if you pick that out of the list, make sure that you are using the NPI number that your organization registered with.
Right. So this next panel is the provider organization visibility. This is what allows everybody to see this case in the system. And by choosing your name, you will allow anybody that's a Qualitrac user within your organization to see this case. The next panel is the diagnosis. The diagnosis, there has to be at least one entered here with a preference to be the most relevant, that may be relevant for the PASRR that you're doing. You can enter more diagnoses if you choose to. We are currently requesting a diagnosis list with the medical record. So that can be, that will be attached later in documents. By entering the diagnosis, you can search by the ICD-10 code. Entering that code, then clicking search, you can pull up and choose the radio button. You can either choose to submit an additional, or just by clicking submit, you complete that diagnosis. The next panel is procedures. And this is nothing that you have to touch. This is just indicating that you've requested that level 1. The next panel that you see is the start of the assessment for that level 1. So the first question is the reason for that PASRR 1 submission. There are a variety of radio buttons that you can choose. Choose the best one that fits for the reason that you're submitting. I would suspect many of you are choosing for pre-admission purposes. But if you choose other radio buttons, and I will show these as well, they will provide additional opportunities to add details. So in this case, I'm going to show like a missing documentation, or in recent inpatient psychiatric hospitalizations, it'll pop out boxes where you can check the squares for why you're adding or submitting for that level 1. Just be mindful, radio buttons are singular and squares for checkboxes can be multiple.
Also, if you make certain choices in those options, when the boxes show up for you, some of those are required that go along with that choice that you just made. So be sure and fill those out.
The next section is the BIMS and the PHQ-9 assessments. While this is not required, it does help guide us as we're completing that level 1 review and looking for indicators of a potential neurocognitive or depression. We just request that you have those, that you can enter them. And it is okay to put a note into this request that says we don't have these details, and it's okay to do that. You have the opportunity to add additional lines. If available, we would ask that you can provide the last 3 scores.
There are options to put notes in the case later in the process, so you can just keep that in mind.
And the next panel is section A, which is the PASRR condition indicators for mental illness. So each of these questions needs to be answered. And the first question is, does the individual have a known or suspected diagnosis of a major mental illness? By choosing yes, you will have additional lines where you can add details. So this is where you can enter potential onset date. And if it is unknown, you can use 1/1/1900, or you can give an approximate date. You can choose if it's a suspected diagnosis or known, and plug in the affiliated ICD-10 code and then make a description. The next question is, does the individual have any signs or symptoms of a major mental illness? You can indicate yes or no. And when indicating yes, you can describe those symptoms. Finally, the last question in section A is, does the individual, are they using any antipsychotic, mood stabilizing, or antidepressant medications? If you indicate yes, there will be some red asterisks for specific medications, potential symptoms, the MI diagnosis that's associated with it, and the name. So the red asterisks are on the medications, the MI diagnosis, and its name that those medications are treating. In the next section is any indicators of an intellectual or developmental disability or related condition. The first question is, does the individual have a documented or suspected diagnosis of an intellectual or developmental disability? Yes or no. If it's a yes, they'll provide a drop down to provide further explanation where you can describe that. The next question is, does the individual have a diagnosis of a neurological condition such as cerebral palsy, autism, etc.? The next question is, has the individual ever received services from or been referred to an agency serving persons with an intellectual or developmental disability? If yes, there'll be a description box. And finally, did the individual sustain a brain injury or receive a seizure disorder and or epilepsy diagnosis prior to the age of 22? And you can indicate yes or no there. In the section C is the provisional admissions. This is where if an individual is on a short-term stay, select yes for the most appropriate item in the group and no for the others. Additional information will pop up in the box with a box where you can describe. So just be careful as to reading these provisional admissions because they're specific to different circumstances for the individual that you are serving that may be qualified for these.
So just a reminder to read these carefully. There is an answer required for each one, and the timeframes are different for each one.
Next you will see is the blue box. And this is a listing of all of the documents that we're requesting to complete the level 1. So a most recent history and physical or any medical documentation with a review of systems from within the last 6 months. You can include vitals if it is relevant to the individual's condition. A list of current medications, a comprehensive list of diagnoses. This could be a skilled nursing facility face sheet or a hospital list. And number 4, if applicable, you can upload a documentation related to any active court orders for an involuntary mental health treatment and or psychiatric medications. By signing your name here, you're certifying that you've attached the required documents. In the next panel, it says, please list the name and contact information for the person who will schedule the level 2 with Telligen. This is the person that our team will contact if a level 2 is needed. I'm just providing a name, an email, and a phone number.
Part of that contact will include gathering information from you, the case manager, social worker, whomever is submitting this. So we appreciate that information. It helps us move that level 2 along.
In the next panel, you see documentation. This is where you're going to attach those required documents that were identified in the blue box. By clicking the add button that's over in the right-hand side that's orange, it'll bring up a separate screen. So you can click and find that file that you need to attach, or you can also drag those documents over and attach them. You can identify the best category that fits the document that you're attaching and the topic. And then you can choose upload, which is the green button. You will do that for every document you need to add. In the final panel, you see is notes and comments. This is that opportunity to talk about if you have other things that you want to discuss regarding the individual, or giving notice saying that we don't have those PHQ 9 scores or BIM scores, and just click the add button. When this is done, you'll click continue. Which then brings you to this screen. It allows you to review the documents that you've added to make sure you've added everything. and complete the user attestation. This is acknowledging that what you're submitting is true and to the best of your knowledge. It is important here that you use your Qualitrac user ID and not your name, because clicking it will pop up this pink box that you see, which is indicating that there is an error. If in the other sections in the previous screen you see this pink box, you can click on the blue highlight where it says attestation or identifies that specific section, and it'll take you directly to that place, and you can make the adjustments to those and then resubmit. I'm just demonstrating this to you so you know that this can happen and there's a way to correct it. So once you put in your username for the attestation, you then click submit. This will give you one more opportunity to add comments, and then you can click submit. Once that's done, you'll go back to the summary. Now I'm going to show you how to complete that, how to find and print those NODs. So we're going to go back to the dashboard. We're going to go into search. You can still do this also through start tasks, but for this demonstration, I'll show you through search. If you know the case ID, you can enter that in here. You can still also do that through member search as well, or scheduled tasks. And this is just showing you that screen, what scheduled tasks looks like.
If we have sent a request for information to you while we're in the process of looking at your level 1 and reviewing it, it would show up here in this as a task for you.
For the purpose of this training, I had a case ID, so I went ahead and entered. And you click search. If you click on any of the blue lines, blue highlighted pieces, so this number, in this case, I clicked on the case ID, this will direct you to that specific case summary for that individual. By scrolling all the way to the bottom, you will see the correspondence panel. This is where you're going to find that request for information letter and that level 1 outcome and a level 2 NOD if needed. There are 2 ways that you can download these. One, by clicking on the blue highlighted lettering, or you can also choose to use that black box with the arrow pointed down. That will allow you to download and print as well.
For most of you doing this, you're going to click on one of those 2 items and it will pop up in a second window. And from here, you can either save it digitally, print it to a printer, or in whatever form you need it.
So once you went ahead and printed, you can return to the task queue. You can go back to the member hub and continue to do what you need to complete work. When you go back to the member hub, you can also review cases this way as well. It'll prompt you if you want to leave the site, and you'll click leave. And you can see all the cases that have been submitted under the utilization management tab. If you see the 3 dots here on the far right-hand side under action, they're called ellipses. And from there, you can go and click view. By clicking on those, it'll pop up and you can see view request or delete. And from there, you can click view request and look at the case. This concludes your demonstration.
Thanks, Cassie. We're going to go back to our slides and complete the next portion of the presentation. Okay, Beth, do you want to pick it up from here?
You bet. Thanks, Pam. So on to tips for submitting a successful level 1. As we saw, there are going to be 2 different timelines for submitting a PASRR level 1 screen, prospective or concurrent. This choice is made very early on in the submission process in Qualitrac, and we've went ahead and included a screenshot here for you to see a little bit closer. Keep in mind that prospective means that the person has not yet entered the nursing facility. They're prospectively looking to admit. And concurrent means that the person is currently in the nursing facility. We anticipate that your group, the group here at the training today, is primarily going to be using the prospective option. As Shelley mentioned in the chat, just a reminder to anybody who's still using paper forms, we are no longer accepting the multi-page pre-admission screen forms. So we do ask that all PASRR business be conducted in Qualitrac. So no paper forms will be accepted anymore. All right, next slide, please. All right, so as you're setting up your case in Qualitrac, you will come to the point where you're going to have to select different providers. And as you can see here, there's a bunch of different types of providers. So we have the treating physician, the physician treating the individual in the hospital or the community. We have the treating facility. This is going to be the ultimate accepting the facility, the nursing facility that the person is going to discharge to. We have the ordering provider. That's going to be your hospital or your CMA agency. And we have additional providers. So you can add, if you're considering multiple SNFs, you'd add them there. There are some questions in the chat about the NPI. So it's very, very super important that you use the correct NPI number that the SNF used to register for Qualitrac with. And so if you don't know that number, you can always get in touch with the SNF admission department, but you're going to want to make sure that you're using that correct or that same NPI number. You're going to put the accepting SNF, as we talked about, in as the treating facility. Say, for example, you don't have the correct NPI number. Telligen subscribes to NPES, and so you can always do a search through NPES for the correct NPI number. You're just going to want to make sure that you pick the right one and not a facility in New Hampshire. I've seen that before, so you want to make sure that everything matches. Again, we're going to make sure that by using the correct NPI number, that this is going to provide visibility to the case for the SNF. So that's the only way the SNF is going to be able to see the case is if their NPI number is entered correctly into this case. CMA and hospital users will also be able to add, as we talked about, additional providers or SNFs for the sake of giving a prospective look at the case if they'd like to see the case beforehand. So keep that in mind. Next slide, please. All right, this is just another sort of screen grab of when you go to submit your level 1. As I mentioned, we anticipate you guys are primarily going to be selecting the pre-admission option for the reason for submitting your level 1, and this is just a picture of that here. Next slide, please. Just another reminder that some questions, as answered, when they're answered yes, they're going to pop up with additional boxes requesting more information. Please fill out as much of that information of the pop-up box as possible. Keep in mind, we don't know the person that we're reviewing, and so the most accurate and most information that we can get from you, the submitter, is going to only help us have a better, clearer picture of the person whose case we're looking at, so we can make sure that we make the right choices there. As we also talked about, any fields that have a red asterisk are going to be required. And then just keep in mind, Qualitrac does require answers to all the main items and then some drop downs. And you will find, like Cassie demonstrated, that you will not be able to submit your case unless all of the required items are satisfied. Next slide, please. Cassie also went over this, but for sections A, B, and C, please, please, please make sure that you read each question carefully and answer each question to the best of your knowledge. Qualitrac, as we just talked about, is going to require that some of those fields be, some of the fields are required. And then of course the other ones that have pop-up boxes, again, just provide as much information as you can. Keep in mind that a QA will be completed to ensure that all of the questions, specifically on panel C here, section C here, the provisional admissions, are being answered correctly, and that all PASRR conditions are being reported, and that the appropriate length of stay is also being indicated at the time that the hospital or the CMA completes the level 1. So please just make sure that you're answering those honestly and to the best of your knowledge. Next slide, please. All right, so respite stays. We understand that everyone's needs and reasons for submitting to a SNF are different. Occasionally, an individual may need to admit to a SNF to provide respite for an in-home caregiver. There are two different types of respite admissions, hospice and the HCBS respite benefit. In this last section, in section C of the level 1, it should be answered yes if either circumstance to a respite admission is applicable. In either respite situation, a level 1 will need to be completed and approved by Telligen prior to admission, but a level 2 evaluation and the issuance of an NOD will not be needed or need to be completed prior to the SNF admission. If the individual admits under respite status and ends up staying longer than initially planned for or initially funded, then an updated level 1 will need to be completed. And then of course, if a level 2 needs to be completed, that will need to get done as well. All right, next slide, please. As mentioned by Pam, we do have RFIs, requests for information. So suppose you submit your case and there's just not, the required documentation wasn't provided, or we just have more additional questions about the case, we will send an RFI. This slide's just a quick reminder of how to avoid RFIs. Avoiding RFIs saves you time, saves us time. So it's always helpful to try to avoid those when possible. So to avoid an RFI, you're going to want to make sure that you submit the required documentation just straight away. So that's going to be medical documentation like an H&P. Doesn't have to be an H&P, but some type of medical evaluation that has a review of systems or evidence of a physical exam that is also no older than 6 months old. We also do request a current medication list for all current medications, not just psychotropic medications. And then again, I go back to the open fields, the open text boxes where you can type. The more information you can give us, it's only going to be helpful, more helpful for us to be able to know, sort of get a better picture of the person that we're looking at. I also would like to mention really quick that if you are aware of, or if you have any 2765 certification documents available, and not all of you will, but if you do, this would be a good time. The level 1 is going to be the best time, or the time that we request that you upload those into the case. And keep in mind, this form is used, this level 1 PASRR form is also used by SNFs. And so it's one form used by many different users. So some of you will not have access to or be aware of any existing 27 certification paperwork. But say somebody's psychiatrically hospitalized, you'd likely have access to this type of paperwork if it exists. So we just ask that if you know about it, that you go ahead and give it to us at the time of that level 1 submission. All right, I'm going to pass to Callie for more information about the level 2. Thank you.
Thank you, Beth. Hello, everybody. I just wanted to go over the detailed process for level 2 contact and collateral so that you have an understanding and expectation of what to expect when a level 2 is indicated. So in the first box, we talk about how the Telligen prep team will contact the case manager to gather information on the best time for the assessment, contacts for collateral. This will happen the same day or the day after a level 1 closes and a level 2 is determined as needed. That contact call does depend on the time of day that the level 1 is completed. Once the contact is made with the case manager, Telligen will assign the level 2 to an assessor who will then reach out to the case manager to gather collateral information and schedule a time for the level 2 if desired. If a time range is desired, the assessor will confirm when they expect to arrive at the hospital or at the person's home. The assessor will be doing in-person assessments as much as possible, but telehealth may be used if there's no assessor available in that area. Arrangements for telehealth will then be discussed. And remember that all telehealth assessments should include a video component. And these should be using Zoom or Teams or some other secure platform. Please remember that FaceTime or Google Meets are not secured platforms, and so they cannot be used. Once the evaluation has been completed, the assessor will submit that completed evaluation to the Telligen QA team for review. And the QA team will then send it on to the state to review and approve the completed evaluation and attach the NOD to the case. The case manager can then retrieve the level 2 evaluation and NOD at your convenience. It usually takes about 2 to 4 days from the time of the psychosocial is completed. Please remember that a completed PASRR includes the level 1 screen and level 1 outcome letter, and when applicable, the level 2 NOD and the PASRR level 2 evaluation. Next slide, please. Okay, so what I'd like to do now is just take a quick moment to outline the different types of evaluations that may be conducted. We have 3 different types of level 2 evaluations. The MI, or mental illness only evaluation, the IDD, or related condition only evaluation, and the dual evaluation. The MI evaluation only evaluation is the most common and those that most are familiar with. These assess for mental illness only, and they are conducted by an independently licensed clinician who then makes a determination about a PASRR condition and recommendations for specialized services. The IDD RC only level 2 is a bit more is for individuals with a known or suspected IDD or related condition such as cerebral palsy or a seizure disorder or TBI that was present prior to the age of 22. These are conducted by a qualified assessor that has extensive experience conducting IDD assessments and will then make recommendations for specialized services. The dual evaluation is a bit more complicated. It is the evaluation that identifies the known or suspected MI and or IDD RC. These are conducted by that individually licensed clinician and assesses for both conditions. The MI clinician will then consult with an IDD specialist. The MI assessor makes the MI determinations and suggests the specialized services. The IDD professional will assist in the determination of IDD condition, as well as suggest recommended specialized services. This evaluation will list the names of both assessors and include both the MI and IDD services warranted prior to the finalization of the evaluation. It is possible, I just wanted to let you know that it is possible that an MI only or IDD only evaluation may identify a suspected co-occurring condition. In these cases, it will be recommended that the facility submit a new level 1 to assess for that condition. Also, I just want to make sure that you remember that the SNF should have a fully completed PASRR packet with the completed level 2 and notice of determination before the individual is admitted to that facility. Okay, so now I'm going to pass back to Pam, who's going to have more information on navigating Qualitrac.
Thanks, Callie. This is just a few items for you to keep in mind when you're in Qualitrac. Remember that you can search either by member or by case. So if you want to track your case IDs, it's a fast way to get right directly back into that case. And as long as the visibility was set correctly, anybody in the organization who is there working, say, the next day, who may need to check on the status of a PASRR in Qualitrac would be able to see that case using the case number. So you have an option of using either one. And next slide, please. If you're going to search by the case number, you would put in the case ID and click any of those blue links in the line there. All of them are clickable, and that will take you directly into the case. If you search by member, next slide, please. You would find the member in the list, click the member, and then you would be directed into the member hub. And within the member hub, you would go to the utilization panel to find the case. To access the case, like in this graphic here, you would find the right case, move over to the action column on the very right-hand side, and click the 3 dots, the ellipses, which would open an item that you would click that says View Request. Once you click View Request, you'll be able to get into the case and locate documents or work on your providers or any of the other things you might need to do. In the next slide, once you're in the case, we want to ask you to confirm the treating facility. If you remember the information that Cassie and Beth both gave you, the treating facility is going to be the nursing facility that the person went to. In some cases, that treating facility may change depending on what happens in the course of you working with the nursing facilities to determine where the person will go. When you originally enter the case, we've asked you to put in the facility that you think is the most likely for that person to go to if it hasn't been decided yet. Once that has been decided, you can come back into Qualitrac and access the case following the instructions that we just gave. And once you're in the case, on the upper right-hand corner, you're going to see an action button. In that action button, you can click Edit and reopen the case. And what that will do will be to allow you to change the provider. Can you go to the next slide, please? Once you've clicked Edit in that action button, you'll come down to the provider panel. And for example, if you're going to change the treating facility, you can click on the 3 dots next to it, which will open up an option for you to delete that treating facility. In this case, Sunny Acres is the one that we've put in. We're going to click Delete, and then a pop-up is going to come up and ask you if you're sure you want to delete that case. You can click Yes, and that treating facility will be taken out of there. You then go through the process that we've described before of adding a new treating facility. And again, we're going to remind you to get that NPI number from that treating facility as you're working with them. And that should be the NPI number that that facility registered with to use Qualitrac. And the reason that is so that they can see this case on their own, and they can get into the case and retrieve documents on their own as well. So in the course of working with these facilities, be sure you're asking them for the NPI number that they used to register for Qualitrac. And next slide, please. Once you've changed out that treating facility, you can move to the bottom of that case and you would submit, And once again, go through the attestation process. Add any notes that you want to add in the comments field there. You might tell us that you changed that facility or anything else that you want us to know about that case, and you would click submit. And once you've submitted, you have completed that change. Next slide, please. Just a couple more notes on navigation. Just a reminder that when you go to retrieve documents for your files, either electronically or that you can print to paper, you're going to go to the assessment panel and you will see the PASRR 1 screen there for every submission that you make. And for those who have a PASRR level 2 evaluation, you'll see that listed here too. You'll click on that link and a new tab will open and show you that evaluation or that screen, and then you can print it from there. And then next slide, please. At the bottom of that case, you're going to see any letters that are attached. The RFI or the request for information, the level 1 outcome letter, and if applicable, the level 2 NOD also will be there. You can click on any of those links and those letters will open up in another tab for you, and you can print them from there, again, either to a digital file or to a printer, whichever way works for you. Okay. And those are our navigation tips and tricks, and I'll turn this over to Margaret to wind up our presentation today.
Great. Thanks so much, Pam. Thank you all again for joining us. And just a reminder, make sure you're signed up for Constant Contact, which is how the state will now be providing PASRR communications. This is the link for that to sign up for it. You'll see PASRR is one of the options you can sign up for. We'll throw the link in the chat so you guys can get that information. Next slide, please. And again, this is the contact information for myself, Shelley, as well as the Telligen team. So always please reach out with any questions or if you're unsure about anything. And just a reminder, as you have questions about the Telligen Qualitrac system, you can call the help desk and they can do a screen share with you and walk you through anything that you might be having trouble with. Next slide, please. Here are some additional resources. We have the main link for the HCPF PASRR webpage. That's where you're going to find the links for additional resources, this training material, and our contact information. So we're now going to open up the Q&A portion of this training, and I see there's a lot in the chat, and I'm sure we have a lot to come. So we'll get to everyone as we're able to. So I'm going to pass to Pam so we can start the Q&A.
Thanks, Margaret. I'm going to take just 1 second to handle the recording, and then we'll start with your questions.